All right, good morning, everyone. Welcome to our Wednesday morning media briefing for COVID-19. I'm Carrie Schutte, the spokesperson for Shasta County Health and Human Services. I'll start out with the numbers and then we'll do some introductions. Today we have a total of 36 confirmed cases, including none from yesterday. We've done 4,638 tests. We've got 4 people in isolation, 16 on quarantine. We've had a total of 4 deaths, and we currently have no people in the hospital. Here today with us, we have Donnell Ewert. He's the director of the Health and Human Services Agency. We've got Dr. Karen Ramstrom. She's our county health officer. Valerie Lakey is from Mayor's Memorial Hospital District. Mark Mitchelson is from Shasta Regional Medical Center, and then Jennifer Andrea is from Mountain Valleys. Did I miss any? Those are all the people that I can see. So we will now invite all of you. There's somebody back. Oh, and Matt Pontes is our county CEO. Welcome, Matt. We are ready for anybody from our representatives, if anybody has anything new to share this morning before we open to media questions.
Morning, everybody. I'm sure there are going to be questions and need for some clarification, but I did just want to mention some new guidance that has come out. I think probably most of you are already aware. So in the last few days, there is new statewide guidance for places of worship, and as well as retail has been allowed statewide. We've been able to do that in Shasta County because we have a variance in place, but now retail is available across the state. And then in addition, in variance counties, partial opening for hair salons and barbers has been allowed. And when I say partial, that means that it's limited to certain types of services. So both for places of worship and for hair salons and barbers, those guidances were developed in response to hearing from community members statewide about the need for these types of services for and activities for our well-being and mental health. And so the state actually released these guidances with parameters in place to allow those activities to move forward, but in a way that reduces risk. And so I think it's caused a little bit of confusion because early on, those types of activities were listed in stage 3. But the state heard loud and clear the need to make some of these activities available. And so developed guidance to be able to do that in a limited fashion, but to be able to start some of those services back up in stage 2. And again, the hair salons and barbers, that's only for variance counties, which Shasta County is one of those. So we're really pleased about that. We're happy to answer any questions. I will say that, we still have cases popping up in our county and then in surrounding counties as well. And so the strategy is to open these lower risk stage 2 businesses and other sectors and then see how it goes for a bit. And so gradually over time, layering on additional openings. And I think that, we've opened a lot of things and that's very, very exciting. But I think we're all going to have to continue to remind ourselves that the idea is to do this in a staged fashion so that we can see what happens and make sure that we're able to contain disease spread if that were to occur in any of these settings. And, I think just monitoring counties in our surrounding vicinity makes it clear that it's still out there. So Butte County's had a number of cases in the last few days. Mendocino and Humboldt. Lake had a number of additional cases. Calusa's had a case. Del Norte's had more cases. And so, that's the reality. And so we're going to be monitoring here locally to see what happens with our case counts as these additional services become available to our community members with modifications in place. And we hope all goes well.
Thank you, Dr. Ramstrom. Does anybody else have anything to add this morning? Robert Folden is here with us now, also from Mercy. Welcome, Robert. Okay, if nobody else has anything to share with us immediately, we'll open up to questions from the media.
Well, could I share first that I never knew that a haircut could feel so good this morning as how it did. But I have a question, or I'd like to get a comment maybe from Donnell. He touched on this last week about gyms. They seem to be just flaunting the order to not be open. And is there anything in between that can be done? As far as I know, we're not doing the enforcement, but more than the education, because it just seems like several gyms have opened up and they don't really care. So I was hoping Donnell would comment on that.
Gyms are not allowed to be open right now. Dr. Ramstrom has had some ideas about how they could open safely, and those were included in the last advocacy letter to the governor. Changes from the state have not been forthcoming, so it's not that we think that every activity in a gym is unsafe. We believe that some of those things could happen with modifications, but right now the state health officer order does not allow them, so they are not allowed and they shouldn't be operating. As far as enforcement, we are looking for voluntary compliance from those businesses and peer pressure from the gyms that have not opened, because of course it creates an uneven playing field, which isn't fair to the gyms that are complying.
Are gyms, people, I know you don't want people in large crowds, so are gyms like a place where they're really more susceptible because of all the heavy breathing that goes on there?
Yeah, I mean, gyms are of course, we want people to exercise, and exercise is outstanding for health. It's very good for mental health, and we all need a boost right now, given all the things that have happened. But we would like to encourage people to exercise outside, and that can be done in a lot of different ways. And so I think thinking about what you do at the gym, and are there ways to do that outside? And I think people who belong to gyms should avoid the gyms if they can, because they aren't as safe as exercising outside. Obviously, when you're outside, you can space yourself out a lot more. You have fresh air, and there's wind blowing that makes it hard for transmission. So, and the reasons that we don't really like the indoor environment is that there's equipment that gets touched a lot by people, and I don't know that there's going to be effective sanitation between every use. You think about weight machines. There's just a lot of touching that's going on inside those facilities. And then, of course, you've got people in close proximity breathing hard. And in some gyms, there's actually physical contact going on between people. So these are all things that facilitate transmission that we really want to avoid. And the general public, whether gyms are open or not, should do everything they can to avoid them and continue to exercise outside.
Thank you.
Other questions?
I guess this could be for either the hospital representatives or for the county as well, but I was reading something over the weekend about, obviously there's been this concern about mental health pieces of quarantine, kind of as you just touched on, Donnell. And from what I understand, from what I've read thus far, it's going to be a while out to forecast, how much is that actually happening, like actual suicide attempts or completions. But I was just wondering if anybody could address, is that something we're either seeing, or is it too early to say whether that type of thing is happening because of the stay-home situation?
Well, that's not something, well, I'll just say no, we have not seen any activity like that. But I will say this trauma season, so we've just entered trauma season, and I'll tell you, it started off busy. So I don't know if that's a function of people pent up energy and people maybe doing more risky things, or if it's just coincidental, but our trauma season has started off quite busy. But to your question, no, we have not seen any of that.
I think that that's an excellent question and something we're going to need to look into a little bit more. We have been focused on other things primarily, but that is a very important area that we have been concerned about, even though we haven't had as much time to look into it. We do know that demand for crisis services went down quite dramatically in March and April, especially in April. However, we do not believe that is because there wasn't a need. Just like we've seen a decrease in reports of child abuse and neglect, there's various reasons for that having to do with the stay-at-home order. There's a lot of evidence already emerging that there are a lot of people who had medical conditions who were avoiding the hospitals because of the messages we were sending about trying to keep them available for COVID-19 and perhaps some anxiety about going there, and which we're trying to reverse, by the way, and tell people to please attend to your medical conditions. If you're having any signs and symptoms of heart disease or respiratory distress or any other kinds of medical conditions, you are safe to go to your local emergency department, and perhaps some of the hospitals can comment about that too. But we just really want to get the message out that people should not be delaying putting off medical treatment. And that goes for mental well-being as well. If people are in a mental health crisis or having a difficult time, they should definitely seek services for that. They're available. They should be open and available, because we don't want people to not get the services they need, because their conditions will only get worse. But as far as answering your question, we can definitely try to get some data. Again, I know the crisis services, I just saw some today, our numbers were down dramatically in April from our normal. But as far as suicide attempts and suicide, I'm going to have to do more research on that.
If someone is interested in seeking mental health services, a great place to go is 211norcal.org or call 211.
All right, thank you. Yeah, I was just, there was a specific article, I don't know if any of you guys saw, out of one of the ABC stations in the Bay Area, that they interviewed some hospital folks and, kind of making it seem like it's already this established problem, and yet the story and none of the outlets that aggregated it cited any actual numbers, and other stories I've read indicated it's kind of hard, a little too early to say whether that's happening. So that's why I just wanted to kind of confirm that that's not necessarily the case, at least here, or it's too early to tell yet. So, okay, thank you guys.
Donnie, I see your light is green, but I do not hear your voice. I don't know why this is happening to you. If you want to email me your questions real quick, I'd be happy to read them out loud. Who else has questions?
Well, I'll jump back in. Dr. Ramstrom mentioned a little bit ago how we kind of want to see how things go right now for a little bit. Do you think we are at a point now where other things won't be opening as rapidly as they have been in the last week or two?
Well, I can tell you there's a few additional guidances that we've been waiting on that are coming. And so those I'm aware of. So for example, we've been waiting on guidance from the state about schools. That should be coming shortly, which is really important right now. Not that school's going to open right now, but they need to do planning. We've also learned that the childcare guidance is going to be updated, and there's going to be day camp guidance. And so I think that they're looking at updating the daycare guidance to have some consistency across all of those three guidance documents: schools, day camps, and childcare. And then I think that there's also going to be some resources for employers and for families with regard to those types of services for their children. So that's all I'm aware of right now that is currently in the works. we have these calls regularly with the state health department, and we're just talking about that last night on a call. And, I think we all kind of feel like we're trying to meet the current need, but at the same time, then figure out a kind of a place to pause where we can kind of wait and see what happens. So I think other than those guidances, that's all I'm aware of right now, Mike. But, other things do periodically come up.
Thank you, Doctor.
I have a question. Will there be any antibody screening available anytime soon in Shasta County?
So I think that you all probably have followed the national news. There's been emergency use authorization of multiple serologic tests for COVID-19. And there's currently some processes in place to kind of compare and make sure that those that are approved meet some standards. And there's a lot of good tests out there, but I think that we're still in this place where we're learning about how to use that information. CDC is currently undergoing some studies to help us to, better understand, does it actually provide, protection? Is it an indicator of how reliable is it an indicator of past infection? And because our numbers are so low right now, the utility is limited. There has been some on a one individual patient by patient basis where it can come in handy. But hoping that testing technology comes along. And so right now, the most widespread use and recommended use of it right now is more for epidemiological studies, and still learning about how it could be used in that manner. And so that's the research right now. And so once that information comes out from CDC, I think we'll have more guidance on how to proceed. And as we have more information from the FDA and the manufacturers about utility of each of those different tests, then I think it will become more widespread in terms of availability and use. It can't be ordered right now, but that doesn't mean it's universally recommended to be used.
Thank you, Dr. Ramstrom. It's just I've heard from a number of people who believe that they had it because they had similar symptoms back in March, but they, of course, have no way of knowing. Is that correct? They don't have no way of knowing without having the antibody screening. Is that right?
Right. And right now, this is going to be accurate when they actually do go get that test. And so it's probably more helpful if it's negative, but if it's positive, we want to know, well, what does that mean? Does that mean that I'm protected? Does that mean that, I had it and I, have evidence of past infection, but was it COVID-19 and was it a coronavirus? I think the current tests are pretty good about differentiating other COVID coronaviruses, but the question is right now, how would you apply that result? And so the concern is making sure that people don't then feel like they're protected when they may not be. So that's the caution right now. Certainly a person could get the test and then talk with their doctor about what it means for them on an individual basis.
I have Donnie Chamberlain's questions. So if it's okay with all of you, I will ask those on her behalf. The first one is, we've passed the Mother's Day rodeo and church window. Do we know how many rodeo folks were tested? I can tell you the answer to that is no. We do not ask people when they're being tested if they where they have been. We would only do that afterwards. And then what do we say to those who say that the rodeo and open churches without positive COVID shows mass gatherings are safe?
I'll take a crack at that. It has been several weeks since the rodeo, and I think we're all happy to see that we don't have a large cluster associated with the rodeo at this time. However, I think that it's important to understand that, number one, there may not have been anyone with the virus at the rodeo. So if there was no one actually infected with the virus and shedding it, then even though there were a lot of people together, no one would get infected. Had there been someone at the rodeo, and there may have been, that person still may have infected people who are asymptomatic or have mild disease and have not been detected or reported to us. So it's not, we'll never be able to say there were no cases. We just know that we haven't identified any. In addition, some of those asymptomatic or mild cases who have not come to our attention could infect other people. And so family members or people who work with them or others in the community could become infected, and they may not know they were infected by someone who went to the rodeo. So we will never know if any cases did arise from the rodeo. And so I guess my message is, again, large gatherings like that at this time are risky. They're risky to individuals and the whole community, and they should not be happening. If we were fortunate and there was no one with the virus at the rodeo, then that's exactly what it is. We were fortunate. But we may still see cases. And I should also add that there may have been people there from other counties. And some of the cases that are being found in other North State counties may also be related to the rodeo, whether that's identified or not. As far as the church, I think you're talking about the church in Chico in Oroville, and I know there have been several cases detected from the people that attended the church service on Mother's Day there. And I know there was also an outbreak associated with a church that met on Mother's Day in Mendocino County that had more cases. I forget the exact number, but it was like 6 or 9 or something like that.
Thank you, Donnell. Her other question is for Matt Pontes. After the Board of Supervisors protest, can you say whether you will consider additional for the public to communicate, such as recorded messages or a mic in the hallway or outside for people to speak so they can express themselves in person in an auditory way?
Thanks for the question. So that is something that we're evaluating right now. In fact, we've got another meeting here in a couple hours on that very topic. What we're trying to do is have a good balance of providing as many ways as we can for the public to interact and provide public comment, and still trying to have a safe environment for that to happen. We're trying to make sure that we're following Dr. Ramstrom's suggestions in our social distancing and trying to maximize our public comment at the same time. So we've got some more work to do on that through technology and through some of the other meetings, but we're really trying to open that up even before the next meeting, if possible. So we're working on it.
Thank you. And then her last question is, did Shasta County participate in Governor Newsom's idea to connect restaurants with qualifying seniors to provide 3 meals a day so seniors don't venture out in public?
So that's, go ahead. That program is in place. I don't have a lot of details. I don't know if you do, Donnell, where contracting is on that. I do believe that contractor was identified, but I don't know the status of getting that up and going.
My understanding is we took a pass on that program because this is I forget the name of it, but it was specifically for providing meals for shut-in seniors. And we talked to a lot of our senior serving organizations, and we had the sense that there was sufficient capacity already to serve that population. And so we did take a pass on that one.
That program had a lot of restrictions on it, and so there were very few people. I think back when we were talking about it back many weeks ago, we were not aware of there was all of our seniors were being served in different ways already. And then a question from someone else emailed to me. Do you have guidance about what the return to play for youth sports, specifically outdoor sports, might look like this summer, and any idea when guidance might be forthcoming on that?
So we don't have guidance on that yet. It was a question that came up on a call last night. And so that has been brought forward to our partners at the California Department of Public Health, requesting input on guidance. Recognizing that certain age groups, you know, we have, when we're looking at summer camps, that might be for some of the younger kids, maybe older as well. But at the same time, what other types of activities can we safely offer to our young people right now? And so that those conversations are in the works, but I don't have a timeline. Sorry.
Thank you, Dr. Ramstrom. Are there any other questions this morning?
Yes, for me, Ms. Schutte, I just to follow up from the youth sports perspective, I have about 300 or so student athletes around Shasta County that are wondering when they're going to be able to have access to their high school's gyms and training facilities. Do we have a timetable on that? Because one of the complaints that I've heard from other parents is that Sutter County has been open, and yet Shasta County and the athletes there still can't get access to their training facilities. What's your take on that? When can we expect the high school athletes to be able to return and start training again and hopefully have a fall season?
Yeah, hopefully we'll have that guidance soon. I can't speak to Sutter County, but I can say that there's not currently state guidance on that, which as you all know, we're under a state order at this point. And so that's where we look for guidance to open up these various activities. The school guidance is supposed to be coming out soon. From what I know about it, I don't believe it actually talks about using the schools before school opens for those particular activities. But that's something I can go back and ask about. And, you know, as soon as we know, as soon as that information is available, we definitely will share it. We know that there's a lot of interest in getting some of these activities for our young athletes, other children who are participating in, you know, practices for different sports back up and going. And so nothing right now, nothing yet out from the state that talks about how we can allow those activities to occur at this time, but we're keeping an eye out for that as well.
We have some health officials who get their mental wellness from softball, so we will be keeping a close eye on that. Elena, did you have a question?
I did, yeah, I just wanted to follow up about the rodeo piece. I know we're all probably sick of hearing about that, but to clarify, since there was that case with the church that you guys essentially linked to, I don't know if you would call that a cluster, but at least a few cases of, you know, local virus. What's the difference there where it sounds like we wouldn't be able to do that? Or is it just that is that because somebody tested positive and then you asked them about where they went and they said, oh, I went to this church, and you had to contact people there? And, you know, what's the difference where you could identify the church, but not necessarily the rodeo?
So I can speak to that. So when we actually do investigation, when a case is confirmed and that comes to public health, we do an investigation to identify where that person might have been exposed in the prior 14 days. So we get a feel for where they could have actually picked up the virus. And then we identify who they've been around since they've been in their communicable period where they could transmit it to someone else. So in the course of asking all those questions, identifying where people have been, sometimes we don't know until we actually do that with a couple people that there's a common link. And that can actually happen over time. So if this disease can actually manifest up to 2 weeks after somebody gets infected, then it can actually take time between those cases. So we didn't identify that church as a place of common exposure until a bit later. And so sometimes that's what happens, unless it was a high, maybe somebody who was very infectious and in close contact with multiple people who might have gotten sick and symptomatic around this, about the same period, which can happen. But in our situation, it wasn't as clear, like right away. And so, as Donnell mentioned with the rodeo, it may be that later on we learn about some things if we have had some asymptomatic people who attended. We don't know if somebody was there that actually had the virus and was able to transmit it at that time. So that's kind of how it works. Sometimes we know right away, and we actually have a cluster of people who have symptoms, and then it becomes more apparent. And sometimes we put the pieces together a little bit later.
Thank you, Dr. Ramstrom. I think Robert had something to add to our conversation. We'll make a spot for you. Hello, good
No, it
morning.
was just around visitation, because it's a constant question that we get. So we've talked about resuming many of the more elective type cases in the hospital. And we're having a robust conversation about visitation every week. So when I met with our infection preventionist, she asked for a 2-week period. So essentially, I've told her every Monday, I'm going to come back with the same question. At what point are we going to relax some of our visitation? Because I will acknowledge it feels a little awkward that we have more surgeries taking place, but we can't allow family members to be here. So just to set the record straight, that's an ongoing conversation. So currently the policy is it's an exception-based process. So there are times when, based on the patient's clinical condition, a family member being present is helpful. So certainly times around the death of a family member or the birth of a family member, or if someone's cognitively impaired or they've been in the hospital long enough where just having that visitation would help them clinically, we're allowing that, but it's all exception based. So we'd ask the public to continue to work with us. It's all centered around preventing the spread of this disease. We've talked about there are so many things we still don't know about the transmission, but know that we're having that conversation on an ongoing basis. And as soon as we're confident and comfortable, and that goes along with Dr. Ramstrom and the state public health officer and the CDC and other agencies, we will relax those standards. And we'll make that very public.
Thank you, Robert. Are there any other questions for this morning? All right, hearing none. Thank you all for being here with us.
I do have just one quick question
Yeah,
for Dr. Ramstrom, just real quick. So when do you think the timetable will be when you set those guidelines in place for allow some of the area high schools to move forward, do you think? Do you have a rough estimation or a timetable?
So, yeah, so if it were up to me, I would be comfortable with allowing some of that now, but it's not up to me. Once the state allows that and guidance comes out about those activities, then we would get that out to the community and work with those entities to make sure that they kind of have plans in place and know how to do it safely. And we would share that wide and far. And so, but that's really up to state to do that, because right now it is not included in stage 2 sectors or activities. And that's all that's open by the, under the state order. And so that we can't go faster than that. We can go slower, but we can't go faster than what the state order allows.
Right. Okay. So there's just no timetable, bottom line.
So again, I think that those conversations are starting at the state level, and when that guidance comes out from the state, then we'll be able to do it.
Okay. Thank you so much, ma'am. I really appreciate your time.
Oh my gosh. And in the meantime, I got an email from somebody who would like me to ask a couple of questions. One of them being, is it safe to travel to cities such as Sacramento now if we're 65 or older? And if not, when might those restrictions be lifted?
So non-essential travel, especially for vulnerable groups, is still not recommended unless there's a real need, in which case it would be an essential activities such as for a medical appointment or that kind of a thing, but still carries risk even in those situations. So as we're gradually opening up different sectors and activities, the idea is to continue to restrict non-essential travel and large group gatherings, because those are activities or exposure risks that actually could actually make our efforts to open slowly fail. So we have to kind of wait on the non-essential travel. Certainly if somebody needs to go for an essential business or for medical care, those kinds of needs, then that's considered essential travel, and that's allowed. We just would recommend that they do it in a safe manner.
Thank you, Doctor. And then one other one here is, I think we've been down this road before, but why is information not shared about where the infected people have been in the community, if that's even possible?
So, yeah, we get this question a lot, and if that information was the way that this disease is transmitted, if we thought that would be helpful to people, then we would notify those individuals. But with the way that this disease is transmitted, especially with this mix of most of us being at home, and so now we are kind of in a period where we're getting more and more exposure. It may be that we identify clusters, as Elena was asking about earlier, in which case, then we kind of learn a little bit more after the fact. But right now, anywhere you go, you're at risk. And so it's not helpful to identify a particular location because the risk is not ongoing. And we want everybody to be taking steps to be protected all the time right now, because we have community transmission, which means anybody you come across in the community could pass it to you. And so if you're in a position where you're out at the grocery store or, at some retail establishment or what have you, or you're, planning to go to church this coming weekend, then we highly recommend you continue social distancing and use of cloth face coverings if you can't ensure that you're spaced from other people that are not part of your household, because every single person could potentially pass it to you. So it's a different situation than when we have other kinds of outbreaks, such as like measles or that kind of a thing. It's everybody is potentially vulnerable and infectious at this point. We just don't know, especially because a transmission can happen when a person doesn't have any symptoms.
Thank you. Sounds just like act as if everybody else has it.
All right, do we have any other questions? Okay, I'm hearing none. Thank you everyone for being here this morning. We'll be back next Wednesday at 11 a.m. and everybody have a safe and healthy week. We'll see you soon.